8 Eastern, 5 Pacific.
A controversial decision by the Obama administration's top health official on emergency contraception and who should and should have access without a prescription. On Wednesday, in a highly unusual move, Health and Human Services Secretary Kathleen Sebelius overruled an FDA recommendation to make the emergency contraceptive bill Plan B Step 1 available over the counter to girls younger than 17. Critics say her decision was based on social, not medical concerns. So let's talk about this more. Joining us now, clinical psychologist Dr. Alduan Tartt, and in San Diego, I know, is Dr. Psychology Wendy Walsh, who is also the co-host of the TV show The Doctors. So Wendy, I'm going to start with you. The FDA says the morning after pill is completely safe for teens to use. Sebelius says there's not enough data on the contraceptive, but she also says she was worried about confusing 11-year-old girls. Why would buying emergency contraception be confusing?
I think that's absolutely inflammatory to say 11-year-old girls. Less than 1% of 11-year-old girls have ever had sex. But the truth is, parents need to get their heads out of the sand. By the age of 18, 80% of human beings have had sex for the first time, Dawn. So does a girl, it's one thing for a girl to go home to her daddy and say, I'm so sorry, I'm pregnant. She needs the support of her family for something like that. But to say, hey, I had sex with my boyfriend, the condom broke, daddy, can you get me a doctor's appointment and a prescription? Let her just go to Walgreens. Let her just go to the drugstore and get something to help her. If they can memorize algebra, geometry, and post all those tweets and Twitters ahead, they can figure out the 36-hour window of when to take Plan B.
Yeah, I know how Alduan feels about this because he's shaking his head no as he's sitting in here. Timing is key with this medication, Alduan. It needs to be taken within 72 hours after sex, but it's most effective after 24 hours. Wouldn't younger teens not have the wherewithal to get to see the doctor that fast?
First of all, if they're having sex, they need to talk to their parents. They don't need to circumvent them to go to Walgreens because they don't want to talk to mom and dad. That's what they need, more parenting, so that they don't think that this is contraception.
But is it about more parenting? Because the fact is that the statistics show that 11-year-olds, some of them do have sex.
Yes, but they're looking for love, and they think that sex is the gateway because we have all this hip-hop music, we have all this stuff on television.
No, I understand that. But that's not what this is about. This is about when that does happen, with the small percentage of time that it does happen.
My daughter's not going to circumvent me and go to Walgreens without talking to me whether she had sex or not. We can have a conversation.
He's talking like a dude. Don, he's talking like a dude. He's talking like a daddy. The truth is, if parents aren't the source of information, which clearly they aren't, if somebody as young as 12, 13, 14 is having sex, then children have been using already the culture for their misinformation. Now they'll need the culture to help solve their problems because they were unable to get the information and go to mommy and daddy. And that's the big point. Parents do need to talk to their kids about sex and prepare them for both, not only the physiological, not just the plumbing lesson, they need to have the emotional lesson.
But now you can just go to Walgreens and say, oh, I have sex. Every time I have sex, I can go to Walgreens and circumvent mom and dad.
Let's say the drugstore, because it's not just
any drugstore and use it every day, the morning after, 3 and 4 times. We know that girls that have sex have lower self-esteem, so they become more and more promiscuous. So we know what's going to happen. They're going to go to the drugstore instead of talking to moms and dads to stop the very behavior we're trying to prevent.
Okay. So some doctors support Sebelius' decision, saying that we would hold off on allowing younger girls to access Plan B until we know how to better educate young kids about pregnancy prevention. So the question is that what you've been discussing? Do they have a point here? First, Wendy.
I think they do have a point that it's about parental education. But, Dawn, if we're talking about a girl who maybe even suffers from violence or abuse in her household, and she's 15, 16 years old, is she going to go home and tell her daddy and risk being persecuted by her family? It's not that she's saying she's pregnant. She's saying the condom broke. And now she's admitting she's sexually active. I think the time to talk to kids about sex is when they ask how a younger sibling got in the tummy. Basically, when they're very little and you start working your way up, giving them information as they're ready for it.
Okay, all right.
Not when they're 16.
This is a great topic, and we can talk a lot more about it. But I want to move on and turn to another topic. It's about horrible bosses. There are a lot of them out there, and some are really bad.
You know that last month you made me work so late I missed saying goodbye to my gam-gam? I'm sorry, what? My grandmother. I told you that I needed to see her because she was very, very sick. You said if I left early I'd get fired. And she died before I made it to the hospital. I'm sorry. Thank you. I had no idea that you called your grandmother.
That was a clip from the movie Horrible Bosses. Well, guess what? Bad bosses aren't just bad for you, they're also bad for your marriage. So, Wendy, what do you know about this?
Well, there's a new study that's come out showing that people who do have toxic or abusive bosses, that those feelings bleed into their own relationships. Now, the interesting thing is the longer they've had a stable love relationship in their life and the bigger their family support is or the more children they have, that tended to buffer the negative effects of what happens with a boss. But let's face it, you know, when you're in a toxic environment all day, it's very difficult to compartmentalize that and come home and be syrupy sweet to everybody else because you've just been abused all day.
You got it. So, Alduan, how do you keep an abusive situation at work from affecting your home life?
I mean, first of all, you get to come home, especially with men, you get to kind of allow them to recharge and do something for at least an hour to kind of just take the day off of them. The worst thing that women do is when they come in and say, hey, baby, I want you to do something, let him wash the day off and then he'll come find you.
Jeez.
Yes.
Some time, right? To just be a guy.
No, you need to take that baby. We've been with that baby for 12 hours. We couldn't even go pee or take a shower. You need to take that baby.
Tell them what it doesn't matter. Give us at least 30 minutes and then we can take the baby. It's like they're standing in the garage waiting on them. We can't even pull in the garage and say, hey, take this baby. 30 minutes is all we have.
You got to recover from that lunch with clients. I know, guys.
All right, I'm glad you two are not in the same room. Thank you very much. We appreciate both doctors.
Thank
New
you.
information